Yes, my viewers and subscribers, once again, a blessed morning. And if it's your first time on my channel, don't forget to comment, like, share, and press the notification bell so that you may be updated whenever I dropped a new video. Junior doctors stay off the job. MOHW contingency plans activated. The Ministry of Health and Wellness is reporting that routine operations at several of the island's health facilities have been disrupted after a number of junior doctors failed to turn up for work Thursday. The ministry, in a release, says it is assuring the public that all efforts are being made to ensure that patients assessing the various public health facilities receive the best possible care. As such, the regional health authorities have direct insight over hospitals and health centers to activate contingency plan that include the assignments of senior doctors to man various aspects of the operations, the release stated. The health ministry in the release said further, priority is being given to emergency cases while appointments for some elective procedures have been rescheduled. Meanwhile, the extent to which the junior doctors failed to turn up for work has impacted the healthcare system is being assessed. The public will be updated on development as they occur. Persons are encouraged to call their health center or hospital to have their queries answered. Then I went on further to search to see what's really going on in the health sector. And I found another headline in the Gleaner. More junior doctors take industrial actions. This is what this headline say. A spate of industrial action have hit the public health system as junior doctors across Jamaica have walked off the job. They are upset about, among other things, contract and working hours. Here's what we know so far. Kingston and St. Andrew, Bustamante Hospital for Children, Dr. Michelle Richard Dawson, Senior Medical Officers at the Bustamante Hospital for Children in St. Andrew, said several doctors have called in sick. It has started to impact our critical areas, especially the accident and emergency department. Across the institution, there have been a decrease in the numbers of junior doctors. Currently, the areas are being manned by consultants, she said. University Hospital of the West Indies. Nordia Francis William, communication manager at the University Hospital of the West Indies, said she had not heard about a sick out. As far as I know, there's no such thing happening here, she said, promising to take a check and to revert to the Gleaner. Junior doctors at the institution have reported that majority of them have called in sick. Kingston Public Hospital. A senior doctor at the KPH has confirmed that junior doctors have been calling in sick. However, calls to Dr. Natalie Wiley, senior medical officer of the KPH, went unanswered. St. Catherine, Spanish Town Hospital. Health service at the Spanish Town Hospital called to an halt this morning as more than 100 junior doctors stay off the job. Over 150 persons who turn up for outpatient service had to be rescheduled. Senior medical doctors of health, Dr. Jacqueline Wright James, indicated that outpatient with dire emergency will be diverted to a residency department. St. Anne's Bay Regional Hospital. Head of the St. Anne's Bay Regional Hospital, Dennis Morgan, is currently locked in a meeting with officials to discuss the plans of action due to the industrial action taken by junior doctors. We are aware of the industrial action, and for sure it is affecting our facility, but we are planning our schedules as we go along, said Morgan. Manchester, Mandeville Regional Hospital. More than 80% of junior doctors of the Mandeville Regional Hospital have called in sick, impacting operation at the facility. Senior Medical Officer Dr. Everton McIntosh said some surgeries have been postponed and that wards are being cleared of persons who can be discharged. He said a sick out lasting more than 48 hours would cripple the operations. Western Jamaica, clinical coordinator of the Western Regional Health Authority, Dr. Delroy Frey, has confirmed that junior doctors have not taken up their duties. He said a meeting has been called to assess the situation. Northeastern Region Health Authority, chairman of the Northeast Regional Health Authority, NERHA, Laura Aaron, says a report provided earlier this morning indicate that operations across the region have been severely impacted by the industrial action. She says she expects to get follow-up report on the situation. NERHA is responsible for the St. Ann region and the Alexandria Community Hospital in St. Anne's, Port Maria, Anata Bay Hospital in St. Mary, and Port Antonia Hospital in Portland. Westmoreland, the Savannah Lamar Hospital is operating at 50% of its capacity. ANOVA, Noel Holmes Hospital, administrators are reporting normal operation at the Noel Holmes Hospital. Trelawney, Falmouth Hospital. Staff members have turned up for regular duties at the Falmouth Hospital. St. James, Cornwall Regional Hospital. Junior doctors at the Cornwall Regional Hospital have taken industrial action impacting operation. Consultants are now handling emergency cases. Southern Regional Hospital or Southern Regional Health Authority, SRHA, outpatient clinics across the Southern Regional Health Authority, which covers Clarendon, Manchester, St. Elizabeth, have been closed and appointment rescheduled due to the sick out of doctors. A total of 150 of the 302 doctors scheduled for duties across the region did not turn up for work. Note, this story is being indicated to the Nordia Francis Williams said that she's not aware of the sick out at the University Hospital. So, right across the region of Jamaica, the beautiful island of Jamaica, the young doctors are really, it's really had it, because I can't blame them. Do you? Can you blame them? They're working under a drastic situation. We have COVID. We have the various amount of sick on the island. We can't stop people from being sick. That's true. And then they have the pandemic stretching all over the island and the money that they're getting paid for. And they too are human beings, so they get sick too. And it looks like now the doctors themselves have a pandemic because it's the whole entire island where doctors, different from the University of the West Indies, who's is saying that they don't have an idea, they're not aware that this is happening. And you see what's going on the island. My Jamaicans on the island, do you see what's going on? Do you really understand what's going on? I'm talking to the young people out there who are so getting off their topsy-turvy and acting like they are more insane than a person that is going somewhere in the mind. Do you actually see what's going on the hospitals? The doctors they also get sick. The doctors are working on the meager salary. And they have to be out there on a 24-hour basis looking after all of us on the island. I'm not living in the island of Jamaica, but I am a Jamaican, and it bothers us who are on the outside to think that what is going on with our families, our brothers, our sisters, our uncles, our aunts, all the generation that we have on the island. And now the doctors, can you blame them? Can you really blame the doctors for not turning up on the job to help you and I on the island? My viewers and subscribers, lend me your views on this. I really need your views. Come on, man. Let's reason together. This is not about disagreeing and don't want to agree. This is about getting to the facts of what is really happening on the island of Jamaica. Our nurses are trying to go abroad to get jobs. And now our doctors that you need on the island don't want to come to work. The money that they're getting paid for is too small for the job that they turn up to do. I thank you all for listening to me. And may you have a wonderful and blessed day. And do remember that though the pandemic may look so, just protect yourself. Please protect yourself. And in protecting yourself, you're protecting others. Walk in peace.